I'm going to go view as learner, might be easier because I've got the master control. So it's divided in sections. And the sections are meant to give you, this is more an orientation video, which is down here as well. So it's just put up high there too. And I know some of the videos are long, guys, I know, but I think you have plenty of time and it's a good idea to watch it, to watch some of them. So basically, all of these things are called orientation resources, training and assessment strategy. This is important. Like we've even got little videos on how to download a file from your e-learning portal, how to edit images in PowerPoint, you know, then your training and assessment plan, you can download it in PDF and Excel. Now, one thing, if I ask you that you can download something, just highlight it, copy it, Command C, type it here on the search box, okay? It'll find that document for you. All right, so if I say something you can download, actually it will find that document for you here if I did something. So yeah, I removed the download basically. It'll show you the PDF for downloading. Okay, guys, so it's just, you can actually show you that. So for example, I've said something is downloadable. For example, this is downloadable, troubleshooting Boss My Account and Authenticator issues. So this is meant for you guys in case you have Google Authenticator issues. So if you literally just put it here, I'll just remove the download. I think the name of the file is in download. So you see this PDF, you can just click on it and you can actually download it right there from that button down here. Okay, so anything you want to find, for example, if you want to also look at, I've got a DeepByte case and just start typing DeepByte. You'll see a lot of articles here. This is a journal article on DeepByte. This is a lecture on DeepByte. I have access to all the courses because it's searching amongst every course. This is different courses. You're not part of that, but it'll show you anything to do with DeepByte. So in 10905 Night Your course, so there's like, if you click here, this is a coaching video of a DeepByte case. Okay, so there's lots and lots of DeepByte stuff, like there will be articles on DeepByte. Also, you can go into files here and scroll down. Anything that I've said you can download is here. Okay, so you can actually, and they're alphabetical. So if I say something, you know, just look alphabetically and you'll find based on that first alphabet or first word, you can find that thing. So a little bit about e-learning portal. So typically in your first month, what I would have expected you've done is this, right? Your first month, you've gone through orientation resources, that section in your e-learning portal, you've set up Slack, you've set up your library access, you've looked at all the past assignment examples. I don't need you to know too much about them, but just browse, just have a look. It's a big section, the past assignment examples. If I go back there, it's a big section, and I really have given you a big section so past assignment example is first up. It's like the next heading, okay? And the reason we're starting with assessments is so you understand what is required of you. And you look at different people's submissions. So Dr. Alex Fu, Dr. Tijana Fisher, Dr. Purvesh Modi, they did really, really good assessments, and we put them in as a sample for you. And whenever we see something really good, we actually place it here. There's also tips for completing your portfolio assignments, but Dr. Purvesh, because he did such a good job, we asked him to write tips for us. And he's actually written tips for you guys on how to prepare, what to do, just very short document is how to actually get through your portfolio, which are your biggest assessments. Okay, your other assessments are quizzes, which are easy. Even if you don't get a pass mark in your quiz of 100%, it'll show you the incorrect answers. You can attempt it a few times until you get 100%. Okay, so everybody gets 100% in their quizzes. Then you have, as you go down, so the past assignment examples, as you go down, right down the bottom is your major assessments. Okay, and I'm gonna, right down the bottom are your PDFs where you can download each one. You can click on each one and download it. But here's your really big chunk of assessments right down the bottom. You have the portfolio, which is based on an adult case. Portfolio, which could be a child or an adult. Portfolio C are based on 2 little kids. Portfolio D is more about treatment. E is more about referring to interdisciplinary, an interdisciplinary needs case. You have an interview that you just click here and book. So each assessment, you can click here and it tells you about the assessment, what to do and how to go about finishing it. And you can upload. So once you click there, you can upload. So obviously the interview Viva, there's no upload, but it's going over what all we're going to assess, how to book it, how long it takes, what are the questions you're going to be asked, okay? And so obviously interview is the one where you don't upload a file, but some of the other assessments like Portfolio C, for example, you have to upload a file. So it's telling you for 2 children, do this, okay? So it's giving you everything. Then for one of the patients, you got to develop a clear aligner plan, submission requirements, you know, and you've got templates. So how do you build this Portfolio C? Well, you've got templates in your orientation resources. The first thing in your portal, you can download Portfolio C template. You just got to plug in your patient's photos and you basically create a single PDF file and you can upload that file here. Okay, so best not to do any other things, but just upload a file. So one single PDF file or your PowerPoint, even your PowerPoint can be uploaded. And we take 30 days to mark any of these assessments because they are quite big. So begin with the end in mind. And when we go back to our plan again, we see that we're supposed to, in the first month, go through orientation resources, set up Slack, do our, you know, look at our library access, look at the past assignment examples, look at all the marking guides, assessment instructions, like what are you going to have to do at the end of this diploma? And also download all the PDF files right down the bottom in your portal. It's just a good idea to go download all of them. And we keep adding some as time goes. As we add new content, we'll add new. And every time we add something new, you always receive an email and you always receive a Slack message saying we've downloaded something new. Oh, sorry, we've uploaded something new. Month 2, I want you to go through a few sections in the e-learning portal called Beginner's Corner, Beginner's Demonstrations, and do Spark orientation if you want access to Spark. If you don't want access to Spark, you don't have to do it. So again, what would that mean? So your Beginner's Corner actually is a very simple thing, Beginner's Corner. They're short little videos on what's a beginner's case. You know, what is, for example, a beginner's guide to orthodontic examination and diagnosis. So I've given you some sort of document here on what's a class 1, class 2, you know, what's the extra oral exam. So very simplified version for you, okay? In extra oral, what are you looking at? Positioning the patient. What are you looking at frontally, facially, smile, teeth? What's, you know, we just give you a little bit of a guide. What's a frontal reference line, like interpupillary line, midfacial line? What are they, you know, signify? We look at facial widths. You've also got a lecture. So this is just a handout, but obviously the handout doesn't tell you everything, but there's a lecture above and you can download the handout as you watch the lecture that goes through all these slides here. There's also an example of a case that I'm coaching for a beginner. So say you're a beginner, you say what type of case I can do. Really, these are very, very good videos that go, this is a good beginner's case, right?
Sorry,
so I've kind of done a beginner's case coaching and I've put it up there because I'm trying to highlight this is a really good beginner's case. I'm also like talking about another beginner case here for restorative, because a lot of dentists will finish up with buildups of veneers. You know, they do a lot of ortho for restorative cases. So this is a really good case for beginners. And as you watch the coaching video, which is me and a dentist talking about diagnosis, treatment planning, you get an idea. This is a good beginner's case. Then you have some flow charts on what to do if I have a class 1 case, class 2, is it mild, moderate, severe? A nice general article on clear aligners in orthodontic treatment, a really nice basic read. So I want you to go through all of these things and understand what they are. These are all demonstrations, quick videos between 2 to 5 minutes, how to do an OPG, how to take a good LADCEF, how to take good photographs, how to edit them, how to do scanning with an iTero, how to put a patient on dental monitoring, how to fabricate vacuum foam retainers if you have a suck down machine, you know, just very simple videos that demonstration, like you're in my clinic and you're observing me. All these videos are shot in my clinic. And then we just got a little how-to video, how to share, save and share Spark approver plans. If you guys have Spark, a lot of people ask us, how do I share Spark movie with you? So we have a how-to video. This is only if you want to get Spark accreditation. If you want to use Spark aligners, you don't have to do this section if you don't want to Spark aligners. The biggest chunk of your lectures is here, Digital Orthodontic Starter course. This is a 2-day program I used to run for my dentist when I didn't have BOSS as a diploma. So I used to run just 2-day aligner courses, and this was the basic 2-day that I used to run. So if you watch all the lectures here, and you've got a video and an audio, video and an audio. So each lecture is supplemented. So some people like to listen to the audio after having watched the video once. We had special requests from our dentist saying, for each of the videos, can we have an audio file? So the same lecture is an audio. The same lecture is a video and an audio, video and an audio, okay? You have right at the top a combined handout of the entire 2 days. So think about, you're with me for those 2 days, doing like a starter course for aligners. And this really, I want you to get through. Recently, we've rearranged the sections. When we did this planning, this part used to be locked down into the portal. We brought it up so that it gets you excited and started. Okay, so this is the basics of aligners, basics of tooth movement, clear aligner biomechanics. It's like you're watching me live in a lecture hall with me. Okay, and I just think reason we've kept it here is because people have told me how much they like listening to the live version. They said the live version is so organic. It's like I'm talking to an audience, because we had 100 people in that room. It was recorded, I think in 2021. 2021, we had less than 100. We had 25, 30 people. It was around COVID. We recorded this in 2021, and you guys basically like as if you were with me. So I want you to watch it like for 2 days and, you know, just finish it. Then you have your unit 1, which everybody tells me they find it very dry. If you find it dry, seriously, there is no reason for you to do this first up. You can do it later. It's just my recommendation that get it out of the way, okay? There's a quick knowledge quiz. People take 5 to 7 minutes to finish this quiz. And the assignment part A and part B, you've got lots of examples. Everybody comes up with the same answer, because you just have to do a literature search, and it's the same clinical question. And we only have very few papers. So most people are critically appraising the same paper. So if you look at a past example, it's not difficult to actually finish this assignment. And then you get into more orthodontic foundation and core lectures. So it's literally my 2-day course up here, the digital live lectures, but even more in depth now. So some of the things you might say, oh, this is repetition, but actually each section goes a little bit further into theories, principle, you know, how teeth move. Today on Invisalign Facebook group, somebody put a thing, hey, can I derotate this incisor in 4 weeks? Okay, and I wrote down, and I said, it's not about time. It's not about the appliance, whether Invisalign can do it, can braces do it. It's whether can you simulate osteoclastic activity in 4 weeks with 50 to 100 gram of force, orthodontic force, and move that tooth, right? At the end of the day, teeth move with osteoclastic activity. So if you want to speed tooth movement, do you know ways to simulate osteoclastic activity? That's the principle. It's not the appliance. So, you know, we think so much like Invisalign braces, but the cellular basis is very important. So we talk about cellular basis here, and it's going more in depth. Okay, so a lot of this goes more in depth, and I have added a few lectures just in this year. We never used to have topic 16, 17. So 17 is all about IPR, stripping and orthodontics, which is also interproximal reduction. And we've added topic 18 this year, which is all about extractions with aligners. And so we are always adding new stuff. For each topic, you have a handout and I think not each topic, some topics. So for example, topic 5, you have a handout here. So you can download the handout and you can watch the video. Then topic 6 and 7, you have handouts. Topic 8, you have a lecture and you have a handout that accompanies it. So if you look at the two things called topic 9, you'll see a handout here as well as, a lecture here. Now, at any time, the reason we give you full access, to be honest, is anytime you have a case, I don't want you to be drip fed the course. So what I want to do is, for example, you have a trauma case. I want you to just type trauma here. Okay. And you can look at all the various topics and files you can download here just when it comes to trauma. So if, for example, you have a class 1 case and you want to talk about class 1, it shows you all the different class 1 things here. I think class 1 would be, yeah, it'll be I. Or for example, we have extraction. You just want to look at some stuff about extraction. You can see that we have some topics on that. Now, that's a quick find. It might miss a few things, but it's a quick find, okay? So this is because I have access to every course. It's telling me which course has what document. But we have, under the 10905 NAT, different things when it comes to extraction. All right, now that I've gone over this overview, and we have only Priya, Shweta, and Tasha, what I want to know where you guys are at with your e-learning portals, because we have such a small group. I'm going to stop talking now. And what I want you to know, what I want to know is, where are you at? What sections you've done? Because if you at month 6, 7, 8, and you want to finish by 18 months, which we really encourage you should, like we can give you a small extension of 3 months. I've told everyone when you join, 21 months we can give you if you really want. You have to apply for it. But if it goes more and more and more, there is a re-enrollment fee. So we do want you to finish in a timely manner. But I do believe there's plenty of time for it if you are kind of following a format. And you do, the first 6 or 9 months is when you spend most of the time in the e-learning portal. After that, it's repetitive. After that, you will find just watching the webinars and doing some cases is all you need. So what I want you to do is go hard a bit earlier, try to finish a lot of the lectures, some assignments. You don't have to do all. You can go up and down the portal. You can watch a case right down the bottom. You can come back up to the top. And you just have to try and follow this format, start taking some records at month 5. So I'm telling you, just here, on month 5, do orthodontic foundation and core lectures in your e-learning portal and start taking some records. So it's just my way of guiding you what to do. So I'm going to go back to the e-learning portal, guys, and I'm just going to go back to the course. So as you see, we have lots of different courses, and we've assigned you to the one that is most relevant to you.